Uniform Medical Plan now offers the Center of Excellence program for knee and hip replacement at Virginia Mason. The program is offered to UMP Classic and UMP Consumer-Directed Health Plan members who are not enrolled in Medicare.
What's different about our Center of Excellence program at Virginia Mason is that the focus is on quality, not quantity. Every step of the way along the process, our goal is to produce a safe, predictable, reliable result for a joint replacement to a patient at little or no out-of-pocket cost. Because we are a center that does a high volume of joint replacements, we've been able to perfect the process to the point where it's a seamless experience for the patient. And because each team member throughout the pathway is engaged in their part of the process, that allows me as a surgeon to spend more time developing a personal relationship with the patient. I think what really sets Virginia Mason apart from other facilities that provide knee and hip replacement is our team approach. So from the very beginning, the whole team is engaged in making sure the patient has a safe experience and a pleasant and enjoyable experience. They will be greeted by the care navigator with whom they will already have spoken with over the phone prior to their arrival. And that care navigator will help them find their way around the medical center, take them to the orthopedic clinic, and make sure they're aware of where their various appointments taking place on that preoperative day will occur. Many patients find that by the time they've met the surgeon, they've been so well informed in the process that they don't have a lot of questions. So it becomes an opportunity to build a relationship with the surgeon and talk about what person's goals are for after surgery and what expectations they have for their recovery, so that we can help support those expectations and goals as best as possible. The role of the care companion is crucial in helping support a patient through the joint replacement journey. One important aspect of the care companion is just simply having two sets of ears to help take in all that information and remember it. And that becomes all the more important when somebody is going through the stress of surgery, which creates anxiety, and then after surgery, of course, you're on pain medications and your body's putting a lot of energy into healing. So sometimes we're not at our sharpest after surgery, and having a companion available who can help you remember all of the details that are so important to your recovery is very important. The decision as to when and if to proceed with a hip or knee replacement is a very personal decision. But the most important factor is the impact that the symptoms from the joint are having on a patient's quality of life. So when it's getting to the point that the joint is dictating to the patient how they're going to spend their day rather than the other way around, that's when joint replacement might be appropriate. So if a member has reached the point where the symptoms from their hip or knee are significantly impacting their quality of life and they're interested in pursuing the option of hip or knee replacement, they should contact Primera to explore this unique benefit that the State Healthcare Authority offers, which is a joint replacement at little or no out-of-pocket cost to the patient.
To learn more about this benefit, contact Primera at 1-855-784-4563.